A brand new research released today by researchers at the University of Newcastle shows that one of the reasons for this two-tier system in the NHS is outsourcing of NHS operations to private hospitals. Before 2010, the biggest difference between becoming ill in the US and becoming ill here in Britain was that in the US, your healthcare depends a great deal more on how much money you have in your bank account. Our huge NHS waiting lists, caused by over a decade of underinvestment and privatization, has started to change that. Graham Kirkwood is one of the researchers behind this new study, and he had this to say about what they found.
We have found that sending NHS patients to private hospitals for their operations has increased inequality between the rich and poor of England. What we're interested in was how the use of the private sector to provide these NHS-funded treatments impacted on inequality by socioeconomic deprivation. We found that in 1997, there were 13 rich hip replacement patients for every 10 poor patients. By 2019, there were 19 rich hip replacement patients for every 10 poor patients. For knee surgery, there were only 9 rich patients for every 10 poor patients in 1997, whereas by 2019, there were 15 rich patients for every 10 poor patients. We found that NHS admission rates have fallen since 2007, as the private sector has continued to grow. And we also found that inequality grew fastest among patients who used the private sector for their treatment. Now, all the main parties want to use the private sector to bring down waiting lists within the NHS in England. Labour says that the policy will reduce the gap between those who can afford to go private and those who can't. Our research shows the opposite to be true, and increasing private sector use within the NHS increases inequality to the detriment of the poor.
The next government, alongside NHS England, have a legal duty given to them by Parliament to reduce health inequalities. Share this video with West Streeting and Keir Starmer and say to them that their proposed solution of continuing to use the private sector is only going to make health inequalities far worse than it is already.